Joyce, take it away.
All right, thank you. I'm so happy to have this opportunity to talk to y'all, at least for a few minutes about process improvement. So this is one of my favorite things out of all the duties that we have and all the hats we wear under quality management. This is one of my favorites. Um, so according to the Institute for Healthcare Improvement, the science for improvement is applied science that includes, and you can see on the slide, there's a number of things. But basically what it is saying is there's a lot that goes into it. There's a lot of thought, there's a lot of planning, but it doesn't have to be difficult. And it can be very easy to set up a process improvement. There's a method to the madness, I'll say. Next slide. There's different models out there that you can use. What I use here is the PDSA, Plan, Do, Study, Act. So this kind of guides you through how to set up a process improvement project. So all my directors from each department have PI projects that they work on, and this is what we follow, and it just helps them walk through the process. So if you're picking a new project, is you need to plan. What do you want to do? What is your goal? Where do you want to be? What kind of data do you look at to plan to see where you are and where you're going to get started, and keep it consistent. So once you plan, now you're going to do, so you're going to put it all together. And this is where you're going to start gathering the data. I like to, for new PI projects, get my directors to start with some baseline data and see where they are to begin with. They may have a project that they know needs some tweaking and improvement, but they don't have the baseline data. So I like to get that first. So then you're going to carry out your plan. You're going to document any of the observations you have. You're going to gather the data, and you're going to analyze the data. And then you're going to put your actions in place. And you're going to continue to gather the data to see the action plans you put in place. Are they working? Are they not? So you have to try something different. And I'll give you an example on the next slide, kind of how we put it together. Next slide, please. So this is what I use for our directors. And this is just how I use it for display. It makes it easy and it's a quick, you can look at it and see. So I first want them to pick their project. Why are they picking it? What is their goal? What is their time frame? Because you can have these projects go on forever if it's, if you're not working it and have clear goals of where you want to be. So I like them to put a timeline. So some projects take a little longer than others, but most projects you can put in place, do your actions, and see an improvement in a short period of time. Next slide. So this is just a spreadsheet and a graph that we use to display our PI projects. You put your goals in, put in whatever you're measuring for your numerator and denominator. And on the bottom is probably the most important piece. Next slide. The summary of the findings. So once you put your data and look at it, what is it telling you? It's not just telling you a percent, it's telling you more. So you have to dig in, and it's almost like doing a root cause analysis. So here's your data. What in that data, or what in the process, and what in your plan didn't work? What in this process kept you from meeting your goal, from making improvement? That's what you need to focus on. And then that is going to be the next slide. The actions that you take. So the summary of findings in your analysis of data is going to tell you what actions you need to take. And maybe it's anything from education of new staff, it may be tweaking the process that's in there. because it's no longer working, or it's just putting that process back in place that you had before. But the actions are, are based on what your analysis of the data is. Then you need to set who is going to take the actions. Thank you, Kim. Who is going to be responsible? And you need to assign it. It's not always just the director, or it's not always just me. Who involve your staff, especially in these clinical projects. If your staff are not aware and don't understand this, you're going to struggle to see the improvement, because most of the clinic ones are based on the staff themselves, the frontline staff who are providing the care to the patient. So assign who is responsible for each action that you have. And then when do you want it to be completed? Set deadlines for them, because like I say, if not, it can kind of run wild and, you know, go into months and months, and you don't want to do that, especially if we're looking at patient-related projects. Follow up. What that means is, once you have identified the analysis of your data, you've taken the action, you know who did it and by when. Did it work? Have you seen improvement? The actions that you've done, is it giving you what the actions or the outcomes that you want to see? If so, great, you're going to continue with that. If not, you need to change your actions. Look at the data again. Is it telling you the same thing, that this is where your roadblocks are for not meeting your goals? And then you take different actions. And that's part of your follow-up, and you start again. So the next slide is just an example. This is looking at our medical office building and patient experience. So a lot of times, pull your baseline data. So in January of last year, we pulled our baseline data and our percentile rank was 51. So that's where we started out at. As we got better and worked with the staff and explained to them, we did have a drop. We had a big change in staff. But you can see from June, we jumped from the 29th percentile to the 81st percentile, and we've carried it on. That's because of the actions that we've taken have worked, and you can see the improvement. And as we go along, and it doesn't show here, but she actually bumped up her goal again because we're meeting it, we're exceeding it. So always reach for the stars. I tell my directors, you know, maybe this is the percentile for critical access hospitals or the national benchmark, whatever it is you're using. You don't have to stop there. Reach for the stars, go further, because obviously here we can do that. Shows easily. So I hope this helps you kind of understand a little bit about the process for improvement. There is a plan. You have to look at it, work it out, decide where you want to go with it, set your goals, and dig in.